Hi, my name is Gynaecologist, and many of you will have already seen me via my website. I'd like to talk now about a neuromuscular pain, or musculoskeletal pain as it's often called, that I see very commonly in those that suffer from endometriosis. It's not exclusive to endometriosis by any means, I just see it quite frequently. Musculoskeletal pain, or pain generated from musculoskeletal dysfunction, is very common in general practice generally. And so it can often be missed as well and underdiagnosed, because not always is it picked up as a cause of presenting pain. So I've written these two nerves down, the iliohypogastric nerve and ilioinguinal nerves. So I'm now going to draw a little bit of a diagrammatic view of the abdominal wall. It's a bit skew with, but it doesn't matter. And that's the belly button. The rectus muscles are the muscles that come down the middle, and there's two big bundles of them. So the fibers run down here like this, and they have these cross striations. So they're the six-pack muscles you've heard about. And then the oblique muscles and transverse abdominis muscles come in from the side. The bony bit of your hips here is called the iliac crest, and you can feel those out to the side there. Now these two nerves start around at the spine. Now if I was to take a cross section through here, then I have the bundles of these rectus muscles with the fibers coming straight at you, coming straight from here. We have the oblique muscles coming in from the side, blending into the back of the rectus muscle. You have the muscle sheath and the skin. Internal skin is here. From in between each intervertebral body of the spine radiate nerves around our bodies, and if we drew a map of where those nerves go, we would look like the Michelin tire man. They supply the muscle to make us move of our body, and the skin. They're called somatic nerves. And so they come around like this, and the bits that provide sensation to the skin puncture through the abdominal wall in various sites, one of which is at the edge of the rectus muscle here, near the edge, and the top one is the iliohypogastric nerve and the bottom one is the ilioinguinal, quite close together. This one has its nerve distribution going upwards, and this one tends to go down and into the inner aspect of the thigh and even the inner edge of the vaginal entrance. Now these quite commonly get nipped at this point, and you can often get a bit of a muscle spasm around where the nerves are coming through, and it irritates them. That's called a neuralgia or a neuropraxia. Leaning into pain can often trigger, as a secondary phenomenon, pain in the abdominal wall, because the spasm of leaning over triggers pain, triggers spasm, and it can be an ongoing problem even after the original cause is gone. So if a woman has endometriosis and you remove that endometriosis, all the other pain may go, but that may persist unless it is targeted. And you target it with physiotherapy, and sometimes we can inject a steroid called Gynaecology in there to act locally to release that muscle spasm. But it is a very common cause for women presenting again with pain that can lead to other surgeries, all to no avail, because you can't find anything inside, because it's not inside, it's in the abdominal wall, not inside the abdomen or pelvic cavity. It's worth knowing about it when you go to see your doctor.